Hello, my name is Dr. Saemundur Rognvaldsson. I'm a physician and scientist um, from Iceland, postdoctoral fellow at the University of Iceland and also at the National University Hospital of Iceland in Reykjavik. And I'm part of the study team doing the iStopMM study. Um, so the iStopMM study is a screening study for MGUS, mostly monoclonal gammopathy of undetermined significance, which is the precursor to multiple myeloma and also Waldenstrom's macroglobulinemia. So the main aim of the study is to test the hypothesis that we can use screening to detect myeloma and Waldenstrom's early, and that this will improve outcomes in these disorders by initiating treatment earlier in the disease course and preventing end organ damage. Now, although we have the strongest evidence for early treatment in myeloma, I think that this sort of early detection of IgM, MGUS, and early Waldenstrom's will also help us both from a practical standpoint, knowing how beneficial it is to detect these disorders earlier, but also just to learn more about where Waldenstrom's comes from. So in our study, we invited all Icelanders born in 1975 and before who were alive and residing in Iceland in 2016 to participate in the study. This is about 150,000 people, so it's like a small town, I guess, in Europe or the United States. So we invited all these people to participate, and just over half of them provided informed consent for screening. And then next time they were at the doctor's office, measuring cholesterol or whatever, or at the ER due to appendicitis or cholecystitis or something, we would get an extra vial of serum drawn during the same blood draw, and then use that serum to screen for monoclonal gammopathies using serum protein electrophoresis. That's where we find these M proteins, and also using a free light chain assay, which is a sort of a second, I guess, more modern test for free light chains, which are also quite common in these disorders. Now, when we think about when we think about IgM monoclonal gammopathy specifically, we actually find around 900 people who have at least one IgM M protein. And interestingly, about 20% of them actually have an IgM, and they have something else as well, like either two IgMs or one IgM and one IgG, which was quite unexpected. And we are now following, so we randomized these people to three study arms. Arm 1, which is the control group, they are not contacted, they just continue as if they were never screened, so it's kind of like a placebo arm, if you will. And arm 2 and 3 are called in for further clinical evaluation, and we follow these people. We do in IgM-MGUS, we do bone marrows, and we do imaging using CTs. So we find that quite a sizable amount of these individuals have what we call smoldering Waldenstrom's macroglobulinemia, which is where you have more than 10% clonal cells or malignant cells in the bone marrow. And we also find that having enlarged lymph nodes or lymphadenopathy is also quite common. It's around 4 to 5% of those who have an IgM paraprotein in our follow-up. During follow-up, we find a lot of people with early disease, and we have some opportunities to treat early, but the current treatment paradigms and the current treatments are a little bit too toxic to treat asymptomatic people. So as expected, we observe the same rate of Waldenstrom's in these people who are diagnosed early. But what we can do, however, is that we will now use this data in order to optimize follow-up for those with IgM MGUS. Learn more about what are the predictors of progression of more severe disease, and furthermore, we are collecting these bone marrow samples and these blood samples, which are taken repeatedly over time from our participants, to then be able to look back on the past when these people progress later in life, get Waldenstrom's macroglobulinemia, for example, And we can now look at the cohort which later gets Waldenstrom's and gets treatment for that, and look back on their bone marrow and blood samples over time and observe how the malignant cells, their microenvironment changes over time, and if there are some markers in the blood that we can use to predict this progression over time. So essentially know what are the individuals that will progress, and also very importantly, what are the individuals that don't progress? What are the people that are just going to be completely stable over their lifetime and will never require any therapy? If you can identify that group, that can both be very practical. We will then not need to follow these people as closely. But also, if we can understand the processes that lead to senescence and stable, benign course of IgM MGUS, and understanding the processes, we might be able to emulate them using treatments for Waldenstrom's and hopefully get insights into how we can treat that better in the future. So I really think that although the iStopMM study, which has the MM in the name, we can really turn the first M around. So it's iStopWM as well. And that's something that we really want to do, is to use this opportunity of the iStopMM study to learn more about IgM monoclonal gammopathies and Waldenstrom's, and both gain these practical insights, but also biological insights into how the disease comes to be.